Have you or a family member ever been bitten by a tick?
Do you know that ticks are the biggest carrier of Lyme disease?
Lyme disease is a bacterial infection transmitted by black-legged ticks, also known as deer ticks.
The bacteria known as Borrelia disguises itself, hiding from the immune system.
It causes an array of symptoms so broad that doctors may not even be able to recognize the disease. In my case, I found a tick on my arm when I was only 7 years old. I pulled it off of me thinking nothing of it until the symptoms sprouted. I began having the erythema migraines, or bullseye rash, that is most commonly the first sign of Lyme disease.
She had the rash for a couple weeks, and I didn't think anything of it. I had her put lotion on it, hydrocortisone cream. She had quite a bit of pain with it.
I was also suffering from trouble sleeping, stomach issues, joint pain, and headaches. And I was eventually taken to the doctor because one side of my face was flaccid. I couldn't close my right eye or move the right side of my mouth.
It was pretty scary. My first thought was, is she having a stroke? But she could move both of her arms and her legs. So we talked to the doctor, and they thought it was Bell's palsy and we're going to treat it with a steroid. But then the doctor came back in and asked if we had ticks in the area because she had also had the rash. I said yes, we have ticks in the area, and they decided to treat with an antibiotic, as a steroid could be harmful to Lyme disease.
She then questioned me about seeing a tick on me, and I told her that I had found a tick on me when I was in the garage, and that's one of the few things I remember about my time with Lyme. But I was on antibiotics and eventually went back to the doctor, and I had a positive Western blot test, which measures your immune system's reactivity against a panel of proteins found on the Lyme bacteria. With the help of antibiotics, probiotics, and vitamins, the disease healed very fast.
We went to Iowa City Neurology to make sure everything was on the right course. She was healing very fast. The Bell's palsy was gone. The use of antibiotics is very controversial on how long it should be. I wanted to extend the antibiotics from what CDC says, which is about 10 to 14 days. I think we went 4 to 5 weeks. But there's also side effects from antibiotics.
My case of Lyme wasn't intensely severe, although it was scary for both of us.
If you want to protect yourself and those you love from contracting Lyme disease, we have a solution for you. Try our brand new tick repellent jewelry. This all-new jewelry is not only durable, it's 99.9% effective when it comes to protection from Lyme.
This jewelry has vibrations that you cannot feel, but the ticks avoid at all costs. It also has a strong scent that only the pests can smell, so they stay away from you completely. This jewelry does not tarnish or break, but there is a lifetime warranty for an added cost of $25.99.
Just $25.99.
Get yours today at buytickrepellentjewelry.com or call the number on the screen today. Here are some tips to preventing tick bites.
Wear long sleeves,
Long pants,
light colors,
use DEET,
and other bug sprays,
check your body for ticks,
such as your waist,
groin,
armpits,
and remove ticks using tweezers,
as close to the tick's head as possible.
pulling straight up.